Yeah, final speaker for today is Mr. Ravikiran Andra, sir. He is a final year MBBS student at Ravikiran Institute of Medical Sciences and Research. Sir has a lot of interest in technology, advanced devices, apart his intense passion towards medicine. Sir believes that the emerging technologies can improve the medical care by many folds. He has a conference paper to his credit and also won a first prize in clinico-pathological correlation competition recently. Welcome, sir.
Good afternoon, everyone. I'm going to speak about medical wearables and beyond. What exactly is a medical device? So it's something, it's a machine that is used to either diagnose a disease or to prevent a disease from happening by diagnosing some other early markers of a disease or to treat the disease. It can be by measuring what is the structural change or functional change in the body, or restoring or correcting the change that has happened, something similar. So typically the purpose of a medical device is, it's not achieved by use of... Okay. Hello?
Long press.
So any medical device, normally a medical device is the thing that is it. The purpose it achieves is not normally accomplished by giving a medicine or something like a vaccine, or asking the person to start exercising or something like that. So you have all heard the saying, "An apple a day keeps the doctor away," but these days an Apple, Android, or Windows phone, or a Fitbit that keeps the doctor updated and gives you information about your health, how many steps you have taken, or how many calories you burnt, and things like that. So in a brief history of the few breakthroughs in medicine, the stethoscope, which is one of the most important discovery that has taken place for medicine, because almost every doctor uses stethoscope every day. So that was discovered in 1816, and then in 1895 the X-ray was discovered. That was the first time you could see what was happening inside the body without opening the person up. So that was a major breakthrough. In 1977 the first MRI scan was done. So MRI is the magnetic resonance imaging. So what you can see with that is basically the soft tissue, that is the muscles, the skin, the different organs, and everything in very good clarity. So you can see if there's a tumor or any other pathology, any other change compared to normal in the soft tissue. Then the first artificial heart was discovered and was invented in 1982, and 1984 there was the cochlear implant. A cochlear implant is nothing but a device that helps people who are deaf to hear. So if the hearing mechanism is defective, but the nerves that carry the signals from the ear to the brain are intact, then you can use this cochlear implant to bypass the hearing mechanism and stimulate the nerve directly so that the person can hear. So yeah.
So where the bone conduction comes into picture?
So basically the hearing mechanism, it has both air conduction and bone conduction. You have this thing called, you have the middle ear that has 3 bones, and you have the membrane. First you have air, you have the sound waves that impact the tympanic membrane, that is the membrane in front. You have 3 bones that transfer these oscillations into the inner ear. Inner ear has fluid and few fibers that sense these vibrations, converting it into sound. So you can directly stimulate you can cause the vibration in the middle, in the inner ear with stimulating bone. Like if you vibrate the bone, that is through bone conduction, the fluid vibrates, it moves in the cochlea. There are these things called hair cells in the fluid. So those move, they stimulate the nerve, that causes an impulse which goes to the brain and you can hear. So both air conduction and bone conduction, it relies on the hearing apparatus. So if anything is defective in that particular apparatus, you cannot hear. Even if you wear a hearing aid or something similar. So what this cochlear implant does is, it has an external mic, okay, and it has a electrode that goes into the cochlea, that is the inner ear, next to these fibers, and it generates electronic impulses. So that stimulates the nerve, and that message is carried to the brain, and the person can hear it. So basically, you're bypassing all the normal mechanism by using a cochlear implant.
So just my doubt is,
Yeah.
if a blind, if a born deaf is, if a
Yeah.
person is born deaf, so still can he hear from a bone conduction? Can he hear?
No, it depends on what is the condition that is causing him to be deaf.
No, I'm saying now for born deaf.
Yeah. No, he is born deaf, but what part of the mechanism is defective that is causing him loss of hearing? If it is in the nerve fibers that carry the signal from the ear to the brain, they'll be born deaf, but you cannot do anything because, you can, till now there has nothing been invented that can correct that. But if, say the membrane, the tympanic membrane, the ear membrane, it is defective, then with bone conduction, they can hear better. Okay, so in that cases, you can also use a hearing aid, or you can reconstruct the mechanism using prosthetics and things like that.
Electrically, how different is an implant from a bone conduction transducer?
See, a bone conduction transducer, what it does is it causes the vibrations, right? It causes the fluid inside the middle ear to oscillate, I think. So what this does is directly stimulates the nerve by causing an electrical impulse. So you don't need the fluid, you don't need any other mechanism. You're directly stimulating the nerve using an electrical impulse, and that impulse is carried to the brain. Okay, and now in 2007, the first bionic eye was constructed. So people who are blind, what they did was they implanted electrodes into the brain where the visual centers are there. So with this device, they see outlines as dots. I mean, that's how far we have come. So if there's this object, they just see 2-3 dots there. So it's not much, but for somebody who's completely blind, that helps them just to move around in the room or at least do their daily activities. So there's a camera, and there's a processor and everything that releases impulses which are carried to the brain, and electrodes are placed into the brain matter, which stimulate the brain, like how the optic nerve carries the impulse, goes to the optical cortex of the brain and stimulates the brain. So it's something similar that has come up in.
You say it's implantable, right?
Yeah. So there's a camera and there's a processor, and you have electrodes directly implanted into the brain. So you do you open the cranium, you place electrodes into the brain, and then you stimulate that part. So the whole nervous system is basically, you have few chemical reactions, and most of it is electricity. So you can directly stimulate that part of the brain by producing very low voltage electrical impulses, which stimulates the normal way of how that part of the brain is stimulated in normal people. So what exactly is a wearable? The wearables are basically electronic devices that you can incorporate into the clothing or somebody can wear, and which should be comfortable to wear and things like that. So most of these are much better than the normal electronics that we have, laptops or mobile phones or something like that, because they generate continuous data. So you can monitor a person 24/7. So they're much better than having a mobile that is going to, collect the data like number of steps you're taking, or even heart rate, pulse rate, the respiratory rate, your temperature, the saturation of oxygen in your blood, things like that. So some of these examples are these days you're getting these watches, Fitbits, and other fitness trackers, things like that. And Google Glasses, they're pretty good wearables. And contact lenses. Google has recently developed a contact lens that detects the blood glucose level. So it's not accurate, but it tells you the trends of blood glucose level, whether it's increasing or decreasing, things like that. So that's very helpful in trying to treat the patient when they have diabetes. So I'll come back to that later on. So the advantages of wearables, they provide continuous data, they are very portable, they're easily accessible. They vastly increase the amount of information we obtain. And they are easier for real-time monitoring, and this data can be directly transmitted to the doctor, who can see the vitals, that is all the major parameters that you can judge the person's health by remotely. You can be sitting at home, you can wear these devices which will record these things, send it to your doctor, and he'll monitor it. So So the disadvantages with this, there are a lot of privacy issues. Obviously, you're monitoring a lot of data. You're going to give away the information of what you're doing, what's your health, and everything. And many of you might have heard that mobile phones may cause cancer, things like that, because they are radiation. But more research has to be done on it. It has to be substantiated. Till now, it has not yet been substantiated. So even these devices, they are Bluetooth devices or something like that that produce some energy. So you're going to wear these very close to the person. So some more research has to go onto that and see the health risks of these devices. So that's one of the disadvantages. And all these devices, because they're pretty new, they're going to cost a lot compared to other devices. I think this is going to reduce as time progresses. So there's a strong belief that wearable technology will take off in the workplace more than at home, because say if a person is working in the factory, monitoring their temperature, their heart rate, whether they're inhaling poisonous gases, whether they're getting exposed to some health risks, that helps a lot for the employers or the organization to improve the safety of the workplace, improve the efficiency, things like that. So so this might also happen that they'll just see, okay, that person's not he's very relaxed, you can put more work to him, something like that. So from where is all this data collected? It's from the skin, from the sweat, and from the eye. You have the tear film, that is a liquid layer in front of the eye. So you can collect different chemicals, how much concentration of what is present and everything from there. And you have built-in accelerometers and GPS and all these devices that you can use. So the skin, basically it's divided into epidermis and dermis. The epidermis is the outer layer, dermis is the next. After that you have a bit of fat, and after that you have all the muscles and everything. So you have sweat glands over here, you have blood vessels and everything. Blood vessels, you have oil glands which make your skin oily, and you have pores through which the sweat comes out. So this is the main mechanism how you can detect all the chemicals that are there in the sweat. So the blood vessels which are present here, they'll seep out all the nutrients like glucose, lactose, and different chemicals into the surrounding tissue so that the surrounding tissue gains the nutrition. So these also go into the sweat and they come out to the surface. So you can detect the blood glucose level by keeping a sensor on the surface. So the eye, there's the clear part of the eye that is in front. You see the blackish. That's called the cornea. So you on top of the cornea and almost throughout the whole eye, you have this tear film. So anything, all the nutrients that come to the cornea to give the nutrient supply, the oxygen and everything to the corneal tissue, that is also transferred to the tear film. So if you can detect what are the chemical concentration that are there in the tear film, you can approximate what's the levels, general levels in the body. So you can extrapolate and you can measure. So there are a few new devices that are tattoos, and you can just put a tattoo on top of the skin that's going to measure all these parameters. So few researchers abroad, they have developed a flexible band that senses the sodium levels, the potassium levels in the body, the glucose, the lactose, and the skin temperature, just by wearing a band on your wrist. So in the ICU, the intensive care unit, the electrolytes are one of the most important things that you have to measure. Potassium and sodium concentrations, the glucose concentration, that will tell you whether the patient's going to, the patient's condition is going to become worse, or it's going to improve, or he's going to be stable at that. So is any person with a cardiac problem in the ICU, these are the parameters that you measure more. So that's the thing. So these electronic tattoos that you can use, they don't need normal hassle of wires or conductive gels or things like that, and they give you the comfort of walking around. They move with the skin. They're very flexible, so they move with the skin. And you can conceal these tattoos by using a like temporary tattoo on top if you don't want to be seen wearing these. So yeah, so you can measure the brain activity by this thing called you can get this electroencephalogram. So the brain waves that denote the brain activity. So so a person having a seizure or a fit, their brain waves are going to be different, and people who are having sleep problems, their waves are going to be different. The brain waves during sleep are going to be different. These delta waves are the ones that are more during sleep and things like that. So right now, this is how they measure the ECG. There are hundreds of many electrodes, and in sleep labs and things like that, they wear these things on their head, and they have to sleep in the rooms, and they sleep throughout the day. So you can monitor what kind of sleep they're getting, what are the brain waves that are generated in sleep. They'll tell you all these narcolepsy, people who sleepwalk, things like that. So you can diagnose these situations by measuring the EEG waves. So right now, this is a new thing that they have developed that. So that's the tattoo. So that's it. That's going to measure the EEG. So it's a much better solution than wearing all the electrodes on your head and moving around there. So
can you please describe how is that possible with a single tattoo?
So I am not too sure of how exactly it works. I'll come back to you on that. But so this is what they recently developed, that it doesn't need a energy source. It works, and the electrodes on that are enough to measure the brain waves. You might have 2-3 tattoos, and those are enough to record the brain waves.
How are they tapping into all the temporal regions?
So I'm not too sure about how exactly. I'll come back to you on that. Okay. So there are these new patches that you can wear that is going to measure the UV radiation that you have been exposed to, whether any dangerous gases that you have been exposed to, things like that. Okay, so diabetes is one of the most prevalent disease right now in society. So you have people with diabetes. Diabetes is it's the starting point for many other diseases. People with diabetes, they're more prone to getting heart attacks, they're more prone to getting strokes, they're more prone to have these cardiovascular. There are two types of things: macrovascular events and microvascular events. Macrovascular are all these heart attacks and strokes and things like that. Microvascular are where there'll be small clots that form every day for diabetic people that are going to cause diabetic neuropathy. That is, they lose sensation in their feet, in their skin. They have loss of vision because some of the retinal vessels get blocked, things like that. So if you can maintain, the aim of treatment of diabetes is not completely curing the person, but just to prevent complications. You cannot right now cure diabetes. You can prevent complications from happening. So if you can maintain blood glucose levels without any peaks of increased blood glucose, that is going to decrease all these complications from happening. So if you can right now, how do you measure at home? People use a needle, poke their skin, take a small sample of blood, and use the portable device to check their blood glucose. But right now there is a small sensor that you can put on your skin, or there's this new watch that is developed that has a reagent on its back, and it's going to measure the approximate blood glucose levels. You won't get the exact blood glucose level, but we don't need the exact blood glucose level. We just need the trend, whether it's increasing or decreasing. Whether it's increasing after you eat a meal, how much is it increasing or how much is it decreasing. So with that, you can decide on the mode of treatment. Whether you can only just give them the you can say, okay, if you exercise, that's going to be enough, or if you take some tablets, that's going to be enough, or tablets are not working, you have to start taking insulin. So you can decide all these things by the trend of increase and decrease of blood sugars, not exactly what's the level of blood sugars. So yeah, so this is the new contact lens that has been developed by Google. Even this, I'm not too sure of how exactly it works. I think you guys are much better at knowing how exactly it works. So yeah, so this will give you an average of the trends, and it's pretty helpful in taking a 24-hour blood glucose level to see what are the trends. When is it increasing? When do you have to give the medication? When can you reduce it? So there's this new device that can take a blood sample without using a needle. So there's a negative pressure chamber that is attached to your skin. Using capillary action, there's a slow seepage of blood into the chamber. So you can take a blood sample. So people who have clotting disorders, where if you use a needle, you try to take a blood sample, the bleeding doesn't stop. So in those type of patients, you can use these devices, or people who don't want to have pain during an injection. So you can use these devices. Then there's a new device which tells you around 10 seconds in advance that the person is going to have a seizure. So that is going to prepare the person next to them, the caregiver or their family member, to prepare for the imminent attack of fits or seizures. So during that phase, they fall, they have uncontrolled movements of hands and limbs. So you can control many injuries from happening because of the fall. Most of the times you have more injuries because of the fall than because of the actual seizure. So you can prevent that from happening in people who are more prone or who have history of having these sort of episodes.
So how can you detect a fall more?
So basically, seizure is nothing but increased brain activity. So you have nerves, so there's increased firing in the nerves. Uncontrolled, yeah.
So people who are tend to fall, the elderly people fall down, right?
Yeah.
How is it? Just my concept is to understand how to detect a fall.
You can use an accelerometer, right?
Accelerometer, you tend to walk also. You tend to walk.
Yeah, the waveform, I think the accelerometer detects for a fall will be different than when you walk. Right. So you're going to fall from a much greater height. Your deceleration will be more once you fall. I think you can, using an accelerometer, you can detect if a person falls. There'll be a sudden acceleration and a very fast deceleration. During walking, it's, I think, rhythmic. So most probably with using accelerometer, you can detect a fall. So in the elderly, you can use these devices. You can, create a watch. Okay, using the present technology, it's going to measure your temperature, your heart rate, your oxygen saturation, your ECG, and it can detect when you fall. So in an elderly person, that is very helpful. You can detect an imminent heart attack. Your heart rate is going to rise, your breathing is going to increase, you're going to start sweating. So all these things you can detect if you're wearing these devices. So you can, if a person falls, it can send a message to the family members or somebody that this person has fallen, or it can directly send it to a hospital saying, okay, this person has fallen at this address, and then they'll send an ambulance over. So that's going to decrease the time between the actual event from happening and the time taken for the start of treatment. There's this concept called the golden hour. So in the first 1 hour, whatever treatment you give, it's going to be much more effective than any other treatment you can give after 1 hour. The damage is already done in the first 1 hour. It can be trauma, that is, it can be an injury, it can be a stroke, it can be a heart attack. So whatever treatment you give in the first 1 hour, that's going to be much more effective than any other treatment you can give after 1 hour. So if you take an example of a stroke, in the first 8 minutes, if you can intervene, if you can give some chemicals or some medication to, basically a stroke is nothing but in the blood vessels in the brain, there's going to be a clot that is going to block the blood vessel. So the brain matter is not going to receive blood supply, and it's going to start, the cells are going to start to die. So that's basically a stroke. So if you correct it within the first 8 minutes, the patient will appear as if he never got a stroke. He's going to have complete recovery, no paralysis, nothing. So in the first 8 minutes, if you can intervene, if you can, treat the patient, they're going to have absolutely no symptoms that they had a stroke. If a person has a heart attack, it's 1 hour. The myocardium, that is the heart muscles, it takes about an hour for the effect of lack of blood supply to start to start affecting you. So that's one of the things. You can use all these devices. If you connect it to the internet, okay, transmit the information to the healthcare system, and that's going to decrease the time between the event from happening and the treatment given. So that's going to decrease the complications, increase the recovery, decrease people dying actually. So yeah, so there's already a shirt that has been created that's going to measure your heart rate, your respiratory rate, and your location and everything, and it can detect an imminent heart attack. So ECG is nothing but the electrical signals in the heart. They're going to change when you're about to have a heart attack, and then they're going to change after you have one. So you can detect maybe 5 to 10 minutes in advance, or if a person is exercising. So when you're exercising, there's increased demand of blood in the heart. So that is going to change the ECG, the waveform in the ECG, which you can detect. And you can say, if you continue to exercise, you might have a heart attack. So that's nothing. So those are the people who have angina. They have chest pain a lot, they take medications. So those are the people who have bypass surgeries and have stents put in them and things like that. So these can be used by athletes and soldiers and people like that. So I told you that diabetes, there will be peripheral neuropathy, that is, they'll have loss of sensation in the peripheries, that is in the feet, in the hands, in the tip of the nose, in the earlobes, things like that. So they're more prone to have injuries. So when you hit something with the toes, you're going to have pain. You're not going to, if that part is injured, you're going to be careful. You're going to make sure you're not going to injure it again. But people with peripheral neuropathy, they'll have more pain. They'll have no pain. So they don't know that that part is injured. Okay, they see, okay, there's a bit of blood, there's a small wound, there's a small injury. Okay, it doesn't matter, it's not paining. So they keep getting injured. So that's going to form an ulcer. That is an open wound that is not going to heal. That might get infected because of high blood sugars. Sugars are very good for growing bacteria. So it's more prone to have infection, and you might hear that people with diabetes, if they get injured a lot, they have amputations, things like that. It's because of peripheral neuropathy and all these. So there's a smart socks that is developed that measures the temperature of the foot, the pressures that are there in the different parts of the feet. So that can inform the healthcare provider that there's increased pressure here, there's more chance of having a ulcer there. So if you can treat it before you have to amputate the wound, it becomes much worse. You can have gangrene, that is infection of the leg and everything. So many people, especially in India, once you prescribe a medication, once you give them a medication, most of them they don't follow it. If you say you have to take an antibiotic for 7 days, they might feel better after 5 days and stop it. So with that, you're going to have resistance that develops in the bacteria, that is in the long run, that's going to be worse for society. So you need much higher dose of antibiotics, much more worse antibiotics, which are going to have more side effects. So you can use these. There's this pill that you can take that is going to keep track of whether the patient is adhering to medication or not. So even in elderly, they might forget to take a medication. So this might alert they might just get a message on their phone saying, okay, you haven't taken your medication, you can take your medication. So addiction is something, especially to smoking, is something that is very prevalent. Smoking is very dangerous. It's related to many cancers, especially lung cancer, throat cancer, things like that. There's this disease called thromboangiitis obliterans. That is basically the nicotine in the smoke and other chemicals in the smoke of the cigarette. They cause spasm. That is, make the blood vessels in the legs and the hands to contract very far. A lot. So that's going to decrease the blood supply to all the muscles and the skin and everything. So that's going to cause ischemia, that is loss of blood supply to these parts, and they'll have more chance of pain. So because of loss of blood supply, the nerves, it's called the pain of dying nerves. So because the nerves don't get blood, they're going to start producing pain. So in these sort of patients, you have to amputate the part which is paining. There's actually no other mode of intervention. So that is one of the things that is caused by smoking. So this concept called pack years. If you smoke 1 pack of cigarette a day for 1 year, it's called 1 pack year. So if somebody has more than 20 pack years, it's more likely that they develop cancers. It's more likely that they develop these kind of disorders of the blood vessels. So there are these devices that detect in a person who is addicted to nicotine or cigarette smoking. They're going to detect when they start craving, and it's going to help them wane off from smoking. Basically rehabilitation, it's going to help them to rehabilitate from smoking. So so these are the new wearable devices. There's this it's basically a motion sensor that you put onto the person. In people who are bedridden, there are more chances of having bed sores. So because of because they're lying down in a constant position, the pressure is exposed on few parts of the body, like the shoulders, the buttocks, the heels, and things like that. So only those come into contact with the bed, and that's where most of the pressure is. So with pressure, that part is not going to get blood supply. That's going to form bed sores, bed ulcers, things like that. So in people who are comatose or who are bedridden, you can put this on them. So that's going to tell you, okay, this person has not moved for a long time. There's more chance of getting a bed sore. You can move them. Just move the postures to reduce the pressure on that part, or bring back the blood flow to that part because of decreased pressure. Yeah. So there's one more device that measures basically it's the same thing. You measure the respiratory rate, which muscles you're moving in the chest. So when you're normally breathing, you don't use all the muscles. When you're having breathless, or you run and come, you're breathing a lot. Your muscles in the nose, they move. Noses flare up. You're going to use your accessory muscles that are going to increase the force of respiration. So these are the things that also happen in asthmatics. So you can use, some form of a device that's going to detect this, and it might tell the parent. Most of the time, in children who are asthmatic, they don't know that they're having an asthmatic attack. Well, the parents have to see, okay, the child is breathing a lot, he's having difficulty in breathing. So you have to detect that and then give the medication, that is an inhaler or a tablet, or take them to the hospital. So using any device that measures these sort of changes, you can alert the parent much before. It's going to decrease the time between the onset of the problem and the treatment. So that's going to improve the quality of life of even the child. So if anybody is an asthmatic, you will know that when you're having an asthmatic attack, it's a very difficult time. You can't breathe. You'll be gasping for air. So these are the things. So there are many implantable devices, like you might have heard of the pacemaker. That's going to, if somebody has a defect in the electronic pathways in the heart, that's going to stimulate the heart to beat. So each time the heart beats, there's a SA node. There are 2-3 mechanisms through which the impulse is generated, and it is transferred to the muscles of the heart that are going to cause the heart to contract. That is, to cause the heart to beat. So normally these devices used to be very huge, and if somebody is having a defect in this mechanism, their heart rate is going to be very low. They're more prone to having arrhythmias, that is irregular heartbeat, and more chance of say sudden cardiac arrest, things like that. So now this is something new that came up a year ago. It's around 1 or 2 centimeters long. It's directly implanted next to the heart, and it basically, if the heart is not producing the impulse, this will produce the impulse and cause the heart to contract. So this is an insulin pump. normally you might have heard people with type 1 diabetes, that is, okay, so there are basically two forms of diabetes, type 1 and type 2. Type 1 is when the body is not producing enough amount of insulin. Type 2 is you're producing insulin, but the receptors are, they're not effective. So you have insulin, but it's not able to act. So type 1 is when you're not able to produce insulin. So the only mode of treatment is you give synthetic insulin from the outside. Normally what you do is they have to take an injection subcutaneously, or that's just below the skin, around 1 centimeter into the skin. You inject insulin, and that's going to do the normal action of what the insulin produced in the pancreas does. So there is this new insulin pump that's going to have a gel membrane that is going to dissolve depending on the blood glucose levels. So the higher the blood glucose levels, the more it's going to dissolve and release insulin. So it's going to mimic the action of the pancreas. So that's what we want. Right now, if you inject insulin, most of the time they go into hypoglycemia, that is low blood sugars. You might be seeing diabetics who carry around a chocolate because they might, have low blood sugars, and they have dizziness, they might fall, they might collapse, they might start sweating, a lot of things like that. So this is something new that has come up. And so there's a reservoir inside, and you can fill it up every 2 weeks instead of having 3 injections a day. So that's the thing. And this is another small chip that you can implant into the pancreas that is going to stimulate the cells in the pancreas to produce insulin. So this can be used in type 2 diabetes, where to attain the same action you need more insulin because the receptors that are there are defective. So there are two cells, alpha cells and beta cells in the pancreas. Beta cells are the ones that produce the insulin. Alpha cells produce this thing called glycagon that increases blood sugars. Insulin reduces blood sugars. So this will stimulate those cells to produce more insulin or less insulin. So this can be used in type 2 diabetes. So cancer normally has these molecules in cancer patients. They're called cancer biomarkers. These molecules increase in quantity when somebody has cancer. So you can detect this much before the symptoms of cancer. So if somebody has, say, breast cancer, they're going to have a lump in the breast, or they're going to have a small wound on top of the breast. Or if somebody has throat cancer or lung cancer, they're going to have breathing difficulties. They're going to have blood on when they cough. So things like that. But these biomarkers are produced in a much earlier phase when there's a much high chance of complete cure. So there are these small implants that you can put into the body that are only going to let these biomarkers into them, and you can detect the increase in mass of this using an MRI. So you have to implant specific implants for each type of cancer. So if somebody might have a prostate cancer that occurs in elderly males, there's this thing called prostate specific antigen. So that increases dramatically just before they're going to have the cancer. So if you detect that, you're going to give treatment for 1 or 2 days, or they're going to have a small surgery and that's it. They don't have to undergo chemotherapy or radiation or any other forms of cancer treatment that's going to be very strenuous on the person and their family. So this is what I already told you about. So there's a watch that has been produced, I think, in the Netherlands. They already made this watch. So it has a reagent on the back that comes in contact into the skin and allows the glucose concentration to be measured every 4 minutes. Okay. So as I told you, if normally type 1 diabetes is seen in the younger age group, you can have type 1 diabetes in children who are even 2 years old. So they have to be given insulin 3 times a day. It's going to be difficult for the parents because they have to, inject the child every day, almost 3 times a day. And children, they run around a lot, they don't eat. So that's more chance of they developing hypoglycemia, that is low blood sugars. So most of the time what happens is, because they develop these episodes of low blood sugars, the parents themselves stop one of the doses of insulin. So that's going to increase the blood sugars, and there's this condition called diabetic ketoacidosis, that is, there's going to be a dramatic increase in blood sugars, and that's going to cause difficulty in breathing, and the child has to be admitted in the ICU for 1 or 2 days for them to recover. So if you have some device that's going to measure the blood sugars in a non-invasive way, that is without poking the kid or something, and you can measure it constantly, you can detect these things. Okay, they're going to go into hypoglycemia, you can ask them to eat. The parent might give them a chocolate or something. The children can't tell you, okay, I'm feeling weak or anything. They just start crying, or they just sit in a place. They're not going to come and tell you, okay, I'm having this particular attack. Adults might do that. Adults might tell you, okay, I'm feeling different. The children just might cry. So these are some things that you can use that can be more targeted towards the children, where you have to monitor. And you can combine this with an insulin pump, so that they don't have to take insulin 3 times a day. So yeah, in elderly, as I already told you, you can use these things, these devices to monitor when they're going to fall, their oxygen saturation, if they're having a heart attack or they're going to have a heart attack. You can inform the relatives to come help them, or the hospital itself. So we did this research in my hospital that people who have diabetes, they're more prone to, they take longer for a blood clot to get dissolved in the body. So most of us do have small blood clots that form in the body. You fall, you're going to have a blue bruise, you're going to have a blue area on your skin. That's nothing but there was a blood, there was that whole area, there was a blood clot, and the blood has pooled over there. So that's why it's bluish in color. So that dissolves by itself. In normal people, if you have a small clot that is formed, a small blood clot that is formed in the body, it's going to take around 120 minutes on average for that to dissolve. So if it is formed somewhere in the leg, in one of the blood vessels, it might get carried to the heart, it might block the blood supply to the heart, and they might have a heart attack. So in diabetics, it took almost 4 to 5 times the time. In normal people, if it took 120 minutes, in diabetics, it took around 500 minutes. So that's more chance of somebody developing a heart attack. Even in a normal individual, if there was a small blood clot that caused a heart attack, in 120 minutes, it's going to get dissolved, blood flow is going to go back, it's going to reperfuse, that is, it's going to go back to the area of the heart that was not receiving the blood flow, and they're not going to have much problems later on. They might have had chest pain, and they have time to go to the hospital, get it checked out, make sure it doesn't happen again. In diabetics, most often, there's no time because it's called fibrinolytic system, so that's slowed down. So you can, so that is basically what I told you about the trend. It doesn't matter even if you're 180 mg per dl of blood sugar, that's pretty high. Less than 126 is normal. So anything above 126 you consider it's high, anything above 140 it's diabetic, and anything above 180 mg per dl you see it in urine. So even if you have a higher blood sugars, it won't affect all these systems. If you have a sudden peak, say you have normal blood sugars and you have a sudden peak of 300 just after eating, so that is the one that's going to cause damage. So that's why you need continuous monitoring to know when is the peak, when are the blood sugars going low. Depending on that, you can give targeted treatment. You can ask the patient to take the tablet or insulin or whatever before they eat food, before a big meal, or in between, depending on when they're having the peak, to prevent that from happening. So most of you might have heard that there are cases of people who have died of heart attack early in the morning. So most of the time why that happens is people who are predisposed to having heart attacks, that diabetes or high blood sugar, high blood pressure, or people who have some clotting blood disorders that are going to increase the chance of a clot formation. In the morning when you wake up, so you're going to wake up because of a sound, because of an alarm or something. So that's basically part of this flight or fight response of your body. So it was there because if there was a big sound, right, during caveman days or something, you have to wake up, you have to run away from what's happening. If there's an animal attacking you, you wake up and then you fight the animal. So that's what is the flight or fight response. So that's the adrenaline there's this molecule called adrenaline that is released during this. So if you might have gone on a roller coaster, you will feel your heart rate increases, you feel more active, you see more of the surrounding, you perceive more sensations. So that is because of adrenaline. So because of adrenaline, people who are predisposed of having blood clots, the clot is formed and that is going to cause the heart attack. So if you can monitor the sleep patterns, if you can monitor the ECG and the heart rate, the pulse, the respiratory rate, the temperature during that moment, you can predict when it's happening. If somebody is having a heart attack, they take around 10 to 15 minutes to realize that they are having a heart attack. They might say, okay, I'm nauseous, I'll just sit down, I'll just have some fluid to drink. They'll not say, okay, I'm having a heart attack, I have to rush to the hospital. So if you have these devices, you know that they're having a heart attack and you can take them to the hospital. If you give them treatment within 1 hour, they're going to survive. Most of the times, they're going to survive unless it's a massive heart attack. So most of the times, the heart attacks that people survive are the small ones. So the doctors tell them, okay, this part of your heart suffered a heart attack, so that part is not going to function anymore. You're not supposed to exercise. They're going to be on tens of medications, things like that. So if you can detect it very early and give treatment, it's going to be like you never had a heart attack. So that's one thing that you can do with these sort of devices. If you can incorporate these things into the daily, if you can incorporate it into the watch, which almost everyone wears, you can, it becomes much better in saving lives, reducing the complications and things like that. So you can also use this in the military. If there are there'll be hundreds of soldiers that are fighting. If there are sensors, so you can detect which part of the body that the soldier has had an injury, what is the loss of blood, or what are there are these things called vitals. So there are 5 vitals: the temperature, the pulse rate, the respiratory rate, the oxygen saturation. So these are the ones that tell you that they're called prognostic. They have any prognostic value. They're going to tell you if the person is going to survive, or they might not survive, or they need lot of medical intervention for them to survive. So in use of a military scenario, you can have many people, many soldiers wearing this, so you know what part of the body the soldier has an injury, what is the condition of the soldier. Using a GPS, you know where is the soldier. So you can send medics and doctors from the base camp to that place to treat them. You can also use these in disaster management scenarios. Say there was a tsunami, there was an earthquake. It's a chaos, right? You don't know what's happening. So in disaster management, there's this process called triage process. So you divide the people depending on whether they're going to survive or not. If even after a lot of intervention, you have to treat the patient for 10 to 15 or 20 minutes, you have to treat them a lot, and even then there might be a chance of they not surviving, then you decide you should spend more time on others, because you have to save more people. Instead of spending more time on one patient and saving that particular person, instead of that you can save maybe 100 patients in a disaster scenario. So in those sort of things, you can if these sort of devices come up, you can make many people to wear it, and then it's going to automatically decide who is the person you have to target first. If you can just treat them for a few minutes and they're going to survive, you first target them and then you go on treating the rest. So you can prioritize who you're going to treat first to maximize the number of people you can save. So there's this new concept of mHealth that's using the mobile. Nowadays, all of us had a smartphone. So if you can incorporate that into all these symptoms, you're part of transferring the data from the device to the doctor or to the target healthcare provider or yourself. Using these things, you can make it much better. So the mHealth platform is already there. So you can use wireless sensors to gather information. You can improve the utilization. You can tailor make the platform medical apps that you can use to diagnose all these things. You can directly send this data to the doctor. You can represent it in a manner that that we understand, and we can understand things better. So, using a smartphone, as I told you in diabetes is something that is very prevalent. So that's why I'm emphasizing on that a lot. You can have a glucose meter that's going to detect it. It can send it to your smartphone. That is going to decide whether you need more insulin or not, and that is going to tell the insulin pump or you to take more insulin or less insulin instead of a standard dose. So that's going to improve the reduce the complications in diabetes and things like that. So just gathering the data is not the most important thing. Once you have data, you have to process it and get proper information out of it. You might have hundreds of parameters. You might have heart rate, what's the heart rate throughout the day. But that's not going to help you unless you say you can decide what part of the day is more important or what type of heart rate changes is more important. So you have to develop these things where you have to integrate the transfer of information, and you have to present it properly to body electronics and implantable devices equipped with these tiny sensors. They can help the physicians do better. So these wearables, they're going to increase the, you can have a hospital network where all the data from the patients is put into this network, and it might go to few doctors who are on duty that time to concentrate on all the patients instead of one at a time. It's basically, if in the wards, you're going to have maybe 10-15 patients per doctor. So you cannot concentrate on everyone at once. So if you can put all these things into one platform, it's going to tell the doctor whom to concentrate more on, and it's going to help, concentrate on everyone and improve the patient experience. So the technology is going to become better. There's more information processing, and it's going to be more personalized for the healthcare system in the future. These medical devices, once they're connected to the network, they're more prone to being hacked. In 2008, the insulin pump was hacked. It was demonstrated. The pacemaker was hacked. Around 2-3 years ago, the Vice President of US, Dick Cheney, his pacemaker was replaced because it was found that his pacemaker can be hacked and it can be used to kill him. So with all these devices, okay, if you suddenly increase the dose of insulin that is going into the person, the patient dies because of low blood sugars. It doesn't take more than 5 minutes or so. So these are the things that are drawbacks of, and you have to concentrate more because you're going to play with patients' lives. It's not just data. So you have to make these devices foolproof, sort of. So these are the possible limitations. So if you have 10-15 devices, they might interact. Like you have 10. If you have a cell phone near one of these PA systems, you're going to have an interference. If you have that in these devices, and it's going to release more insulin, or it's going to increase the heart rate or cause irregular heart rate, it's not going to work out. So till now, that is one of the limitations, that there are many wireless technologies that are going to interfere, and we have to take care of limiting that. And with this also, it's going to decrease the patient-doctor interaction. You might just be sitting at home, and your doctor might just be viewing it on a monitor, instead of you going to him and he examining you and talking to you and things like that. So yeah, there are a lot of ethical issues. Like I told you, they can be used for bioterrorism. All these devices that are connected to the network can be hacked, so you have to take care of that. And so there is a potential for misuse, and patients have to accept this. They might not feel this is very important yet.
As a doctor, how would you motivate the subject to get more involved in the process?
So first thing, you have to reduce the cost. Most of the patients, they decide more depending on the cost, because most of the medical devices are very costly, and it has to be targeted. You have to explain why this is more useful. In elderly, if they're living alone, monitoring them is very important. You can save, you can prolong their life, you can save them when they have a mishap, things like that. So you have to, if you explain it to the patient properly, and if it looks good, say most of the people who have hearing loss, they don't want to wear hearing aids because people can look at the hearing aid and they might think, okay, he's deaf. They might judge the person. So these days there are hearing aids that look like earrings. Okay, so those are the things that have to improve. Patients are going to be more compliant to wearing a hearing aid that's going to look something normal than something that actually looks like a hearing aid. So I think those are the things. And if you say that it's non-invasive, you take a diabetic, he has to measure his blood glucose levels at least a week. That's a proper thing to do, that you check your blood glucose levels at least once a week. So they have to use a needle, poke themselves and check their blood glucose levels, or they have to go to a hospital, give the blood sample and check it. So if you have a device that's like a watch, you wear it, and it's going to do everything for you, it's non-invasive, you don't have any pain, then that is going to motivate the patient to incorporate that into his life. But the first thing is the cost. If the cost reduces, the more number of people are going to accept it. Right now, if say the device costs 20,000, you're not going to have people who are going to say, okay, I'm going to use this watch to check my blood sugar. Instead, I'll just buy this 1,000 rupee device that I can do it at home. Okay, it's going to pain a bit, but it's not worth 20,000 rupees. So those are the things I think, and we have to assure them that your privacy is. Right now, privacy is something that everybody is talking about. So we have to address these issues, I think, to get more people involved and get more people involved in this. Yeah, so that's the thing. These are less invasive methods. It's going to increase the patient compliance, I feel. And you can monitor if the patient is taking the medications or not. That's going to help you increase the outcome of the treatment or plan the treatment. There was this case in the clinics once. One of the patients came with asthma. So with that, for asthma, you use a inhaler. So you keep it in your mouth, you press it, and you inhale the drug. So that's going to relieve the symptoms of asthma. So the patient, she came to the hospital on day 1. We prescribed her this medication. She came back the week later, there was no improvement, and her symptoms were getting worse. So we tried to change the medication and increase the dosage. A week later, she comes back, there is still no improvement. So my professor, he asked her to just demonstrate how she was using the inhaler. So she took the inhaler, she did this. She put the drug on her neck as if it's a perfume. So you can monitor these, okay, if they're wearing, say something is incorporated into the device that says, okay, they inhale it properly, proper method was used to inhale the drug, then it's going to tell you, okay, it's not the way that they're taking the medication, it's the medication that's the problem. So, okay, that was something wrong in our part that we didn't explain how exactly you have to do it, but yeah, so those things do happen and we have to be careful of those things. So, yeah. Any other questions?
So what is the accuracy rate for this? Like, are there any false alarms?
It's better to have a false alarm than having no alarm. Okay.
Are there chances?
Yeah, there'll be chances. Say if you bend down and then that's going to detect that you fell. Okay, so that's going to alert you. An ambulance is going to be sent to your home. That's not going to work out. So you have to keep some measures to prevent that from happening. You have to. That's all. That's what you guys have to do. You are, I think, biomedical engineering students, right? Huh? Okay. So you guys have to build these things so that doesn't happen. So if somebody is having a heart attack, in diabetics especially, they're not going to have pain. They'll just have nausea. So that can just be because of some indigestion or gas. So they might ignore it. So that's going to that's going to cause them having, okay, they might survive that, but they're going to have a massive heart attack next time, and they're not going to survive that one. So if you have these devices, it's better to know that it's a heart attack, then say, okay, it might not be a heart attack, I don't want to. In India especially, most of them don't want to go to the doctor, most of them don't want to go to the hospital. Then they say, okay, let me wait and see what happens, let me wait for much longer time, let's see what happens. So the longer you wait, the longer you take to intervene, the more complications there are, the more effects there are later on. So the best example is stroke. In 8 minutes, if you intervene, if you stop the, if you reperfuse the area, that is, you bring back the blood supply to that area, they're not going to have any problem later on. Otherwise, they're going to have paralysis. They're going to be paralyzed. They're not going to they're not be able to move their arms. They might be comatose. They might die. They might not be able to speak. They might not be able to understand what you're saying. So, in those type of situations, it's better to have a false alarm than having nothing. So, in India, as I told you, they just wait. So, let me see what's going to happen. So, 8 minutes is a very small time. You have to intervene in 8 minutes, not go to the hospital in 8 minutes. And in India, there's a lot of traffic, so most of the time the pizzas in India reach faster than you go to the hospital. So these things, I think, reduces the time in intervention and the actual event from happening. That's it. Any other questions?
You have some questions? Questions are over.
Only one question I will ask.
Yeah.
Actually, for cancer cell, to find out refractive index, in literature, I don't have any idea of biology, they told us single cell detection is required. So single cell detection, how it can be done, then I find that you have to smear between the two glass plates, and then you have to see from microscope and to detect, and then it will go to centrifuge, something big process. So can our college biotech student, if they want to do with their health, so anyone can to find out how to find out single cell.
Okay. So I'm not too sure about the refractive error, what happens in that part. But a cancer cell is something that the shape of the cell, the normal structure of the cell changes. You have, in a cell, you have the cell and you have the nucleus. So in cancer cells, they're not going to appear the same. They're going to be much more bigger, or the shape of the cell changes. Yeah, the size of the nucleus is much more than the cytoplasm. Cytoplasm, I think you guys know, it's the normal content of the cell, the nucleus is inside. So you see the ratio between the nucleus and the cytoplasm. So these are the things that tell you whether it's a malignant cell or not. So yeah, I think there's going to be some change in refractive index also, because the thickness of the cell changes, the materials inside the cell changes, the nucleus is more dense. So I think if the nucleus becomes bigger, then the less light is going to pass through it. I think.
And also, sir, the temperature of a cancer cell is always higher than the normal cells.
Yeah, so a cancer cell is always growing. So the metabolism is nothing but the normal process. So that's continuously happening in a cancer cell. So what exactly is a cancer cell is? The inhibitory parts of the metabolism, the cell replication is inhibited. So that's not there. It's uncontrolled. It's an immortal cell. A cancer cell is an immortal cell. It doesn't die. So that's the problem. That's why it keeps on growing. So because there's a lot of metabolism, there's a lot of chemical process happening, its temperature is going to be higher. So even if you take a person who has a tumor, say in the leg, say a tumor in the bone, that part of the leg is going to be, the local temperature is going to be higher than the rest of the body. Because that part is continuously growing, it's continuously using glucose, it's continuously, the metabolic process is continuously happening. There's no break in it. So even we are constantly maintaining 98 degrees Fahrenheit because of our metabolism. So different cells metabolize for some time, they stop, the metabolism slows down, they increase. There's this thing called a circadian rhythm. So depending on the time of the day, different cells are more active, different cells slow down. In cancer cells, that doesn't happen. It's continuously metabolizing. So its temperature is constantly high compared to the rest of the body. So it's not only going to be for cancer cells, even if you have an infection, there's going to be a lot of metabolism, even those cells are going to have higher temperature. So an infection, if you have an injury, normally that area is going to be warmer than the rest. If you say have a sprain, that's going to be warmer. If somebody has arthritis, the knee joint is going to be warmer than the rest of the body. So,
as you told, like in diabetes, the diagnosation is known for controlling the glucose levels. So if there are already clots in the blood, is there any method to clear those clots?
yeah, so there are these drugs called streptokines. They break down the clots. So those are already there. They are the ones that the doctors administer to give the patient when somebody comes with a heart attack. First, you give these things to break down the clot. So that's what you do. When somebody goes to the hospital with a heart attack, that's what you do.
So what if the clots are too small and what if they don't detect it?
No, the blood vessels, they continuously go down, decreasing in diameter. So the aorta, that is the main artery that comes out of the heart, is around 2 centimeters wide. But by the time they come to the fingers, there'll be sometimes there'll be around 7 millimeters or 7 microns wide. So a clot is going to get lodged somewhere. If it cannot be smaller than, normally a clot has a fibrous area. In that, RBCs, different cells get lodged, and you're going to have a mass. So fibrin, there's this thing called fibrin, that's basically something like a fiber. Okay, so that's going to be a mesh, and all these cells get lodged in that. So that's going to form a small mass. So that's going to travel in your body, in the blood vessels, get lodged where the diameter of the clot is smaller or same as the blood vessel. So however small the clot, it's going to get lodged somewhere. So that's the reason diabetics have microvascular events that are diabetic retinopathy, that is they have loss of vision, they have peripheral neuropathy, that is in the small capillaries in the hands, near the nerves, there are clots which are going to reduce the blood supply. Those parts of the tissue is dead, so you're going to lose sensation. So you cannot have the smallest clots are the ones that cause the problem.
So is there any means that you can detect a clot, or if it is a clot? The symptoms is that you have a clot, but then how to detect a clot? Is there any?
You cannot detect a clot in blood. Sometimes there's this test called D-dimer. So you can use that to see that, okay, there's more, okay, basically you cannot detect clot formation. You can only detect it once it has already blocked a vessel, stop blood supply to that part, and then you know, okay, that part doesn't have blood supply, that's when you start having symptoms. So there are 3 major things that cause a blood clot to form. Altered blood flow. So normally in all the blood vessels you have laminar flow. So in between in the center you have the red blood cells, and then you have the platelets, and then you have plasma throughout. So if this is altered, if there's a turbulent flow, there's more chance of developing a blood clot. If you have increased viscosity of blood, there's more chance of developing a blood clot. So you take all these factors into account, and then you say, okay, this person has a higher risk of developing a blood clot, or this person has a low risk. So that's why people with high risk, they're giving ecospirin, you might have heard, that's aspirin, that's going to prevent a clot from forming. They might be given drugs that reduce the cholesterol, they're called statins. So they reduce the viscosity of blood. So you can address these risk factors which are going to cause a blood clot. but you cannot detect that, okay, at this time there was a blood clot that was formed, and then few seconds later or few milliseconds later, it blocked a blood vessel and the effect happened. So you can only detect it once the effect has already happened. That is why it's more important for us to control blood sugars, control the cholesterol, and prevent this from happening.
Some more questions, please. So I think we'll time. Yes, Ravikiran. We have a small book for you. All the best. I hope you had a nice time.